Thank you both very much for getting this started. This is a community conversation, and I will do my very best to make sure everyone has an opportunity to ask a question of either or both of these gentlemen, and we'll just do it by if you would raise your hand and kind of say who you are so that we make sure it's a friendly conversation that everyone can enjoy. And speak loudly because the room is big and it's hard to hear, and we want to benefit from any question you might have. Sir?
So I want to make it clear that Delegate Landes talked about a great deal of increased funding. I'm the treasurer of the CSB down in Valley, which is in Stanton. The net effect of the changes because of Medicaid expansion is that our budgets at the CSBs have gone down. Our funding has gone down. I think our figure is like $259,000 in Stanton, and maybe yours is $300,000, something like that. That affects us. The assumption was that Medicaid expansion would bring a number of self-payers into the Medicaid world, and that would help make up for it. But let me tell you about Medicaid expansion. It has not been handled really well by the administration. Only about 60% of the eligible individuals are enrolled right now. This is the only state where you can expand Medicaid and people lose access to health care. There are individuals who have waited far longer than the federally mandated 45 days to get determined and find out whether they have Medicaid or go back into the federal marketplace. So that's a significant issue, and those individuals can't come to the CSBs. The other thing is that Step VA that was mentioned was written and designed before Medicaid expansion, and there are some issues with the possibility of the requirements of Step VA causing the CSBs to bill individuals for their insurance, including Medicaid, procedures that have already been performed by their PCPs, and therefore they would be denied that coverage, and so the CSBs won't get covered. That needs to be deconflicted. All right. Community contribution. So this is a Dillon rule state. Do you understand that?
No.
The state legislature has a great deal of power and gets to tell the communities to do what they want to, what they have to do. To include, like, say that we raised the teacher salaries by 5%, but really they raised it by 3%. The localities raised it by 2%. There is a community contribution to the amount of the budget that is supposed to go toward the CSBs. And in the case of my area, the localities do not make their full contributions. So that's another delta that's not being dealt with. And you're aware of that. I know that, Delegate Landes. Another thing with Medicaid expansion is that, and I think that the executive director of the CSB here mentioned this, the providers. We don't have enough providers that are available to Medicaid enrollees. And part of it is the funding part of it, but a lot of it is that while DMAS went out and did a lot of recruiting for individuals to enroll, they did not go out and get providers encouraged to enroll. Because providers will find out that with the way that Medicaid expansion is set up, they can actually cover their costs, and it is beneficial to them. There's a couple of problems. There are providers that just can't take any more patients, and then just not enough providers in gross total. Discussion about the expansion, it eliminated the GAP program, the Governor's Access Plan, which was a great program for people with significant mental illness. It got them some coverage, at least inpatient. That's gone now, but there's still a set of individuals who are not covered by Medicaid or the federal marketplace because it's prohibited by law to be enrolled in either if you are incarcerated. Individuals leaving incarceration, returning to the community in diversion programs are still incarcerated. That's a 5-month period, and I think Senator Deeds pointed out it's essential that when individuals leave incarceration, they are returning citizens, they get housing and access to health care. That's 5 months when they don't have access to health care other than hospitalization. Well, we don't want them to have to go to the hospital in order to get enrolled in Medicaid. And even if they're released from the hospital, they can't get the outpatient care. That's a gap that needs to be filled. And that's a significant gap. I tell you, I have an intern from JMU working with me. I'm a healthcare navigator. We were at the DSS office the other day, and a gentleman came rolling over to me, reintroduced himself. I had taught him a month ago about the whole access to healthcare thing at a reentry class that the Department of Corrections does. This one is in particular down at Cold Springs. That program is extremely effective. That individual was fully released, and he did listen to what his instructors were telling him, and he did apply for Medicaid, but with a 45-day wait right now, that's 45 days without treatment. There is a sheriff who I will hail who has the HEART program. He's got a heroin addiction treatment program going on in his jail down in Chesterfield by the name of Carl Leonard. It's a model. That's something that every prison needs to get rolling. So there's a whole lot of work to be done. I don't want anyone to think that because the funding in total has gone up significantly that the CSBs are rolling in cash, because we're not. And being the treasurer, I see this every month. So that wasn't a question. I think you retired.
That was a sermon. I suggest, yeah, amen. Before you fuss about dollars, you need to go back to your locality and say 10%, friends. Either put up the 10% or shut up. That's what it comes down to. And localities under the law have to put up a 10% match of the general fund appropriation. Augusta doesn't. So
Waynesboro doesn't. Stanton doesn't. Highland County does.
That's new to me. That's new to me. Yeah. But the local match is interesting. When we talk about the 40 CSBs being different as night from day, Fairfax County, 10% would be $5 million. They spent about $124 million of local money. Now they are wealthier than most. Right. But $124 million when the state law only requires they put up 5? How come they get it, nobody else does? You know, and you can point to a few CSBs: Arlington, Alexandria, Loudon, Prince William to lesser extent, Virginia Beach, Henrico, Chesterfield. Those are the localities that put up most of the money statewide. So we have a significant problem. A lot of the things you point out aren't really things we control by law. They're things the department, it would have been better, it would have been good for you to have somebody from the department here to deal with some of Pastor Sullivan's concerns.
As a facilitator, I would like to note, though, that our locality has been very generous to the CSB, so we are not in the same situation as that.
Yeah, I did say DMAS, by the way.
Oscar Scheichel, Rockingham County Schools. It's really not a question but a request to the General Assembly. I think what's most important for us is that we have flexibility in how we address some of the behavioral and mental health issues. And it was great to see that in the select committee about school safety, in the tour that we did together, that we had a really good conversation all day about that being a key component in school safety. That it's really important for students to feel safe, to feel connected, and that we can increase our services in that area. I love our school counselors, but there are school counselors who did not receive the same mental health training that some of the counseling programs now provide. And so I think when the General Assembly then, the name change from guidance counselor to school counselor, of course, doesn't change the qualification, the abilities of those counselors. And what we did last year was really connect with the CSB. So what we wanted to add were early intervention counselors. So last year we added 2 early intervention counselors, and we didn't hire them as school employees. The CSB hired them because in most cases where you see students with mental health issues, with behavioral health issues, students that come to school traumatized, the family needs help. And so CSB hired the counselors, we basically pay for the services, and so then you get these wraparound services that can be added through the CSB because of the wonderful work that they do. But the early intervention counselors, they don't count as school counselors. And so where we need more early intervention counselors or more board-certified behavior analysts, more behavior specialists, those are all the critical services, but in the language, that flexibility isn't there. And so what I'm asking the General Assembly to do, and also the Department of Education, is that there's some flexibility in how these ratios work. Because if we just have school counselors now spend all their time on counseling, and they're not as qualified in some cases as those early intervention counselors, or the work that our behavior analysts do, then we're really providing the service intensively, but not really in the right spots. And so I think that's my big request to the General Assembly, that there's more flexibility in how we address this, because we want to add staff, but it doesn't always have to be the person who went through a school counselor program and has that certification, because it's a very specific program and it doesn't always address exactly what we need.
Let me suggest. I think you've hit a point, Dr. Schleckel, that I think both the Department of Education and then the Department of Behavioral Health are going to have to talk through, along with, I think, the study that Cree's continuing to do. I think they can make some recommendations. But the problem, as you know, is we set positions for education in the SOQ. It doesn't provide the flexibility I would like to see, long term. It seems to me we could start a discussion with Dr. Lane and say, let's look at, or have the Board of Education working with the General Assembly look at those positions and see if again, whether they're employed by the CSB or the department, that you still get credit for those positions, but we don't get wrapped around, whether they're in the educational system or through the CSB. There ought to be a way to figure that out. Probably take legislation to do that. But I think working with Cree's joint subcommittee, and I would promise you, I think that's a great idea. I'd be glad to talk to Dr. Lane. I'm not going to be a lame duck until at least December, so I'd be glad to work on that. But I think that you've hit on a good point, and I think that would also be able to let us stretch those dollars for school systems if CSBs can work in conjunction with, just exactly like you were saying. We also might want to look at the definition for school counselor and see if we need to go back and readjust kind of how that is described, and maybe we need to make it a little broader. But more importantly, also I think the goal is that, as you said, we want to make sure that all school counselors have that behavioral health, mental health training in addition to the other training that goes with those positions. So I'll talk to Delegate Wilk about that. Whoever is elected from the standpoint of who's going to represent the 25th, I can point that out, and be glad to talk to the local senators too that represent Rockingham. There ought to be a way to do that. I unfortunately won't be able to file any bills, but I'm sure we can figure out a way to do it.
It's a really good point. Back, remember last year, I introduced legislation to build mental health awareness into the health curriculum for 9th and 10th graders. And the whole idea there was to help defeat the stigma and give kids some basic tools of what to look for and what in themselves and other people. But one of the things we were looking at that time was strengthening the connection between CSBs and schools. And when Ms. Harrison said that you basically already have that relationship, when we talked about the 40 CSBs, you've seen one, and we're talking about the funding issues. I mean, you've got a good relationship and a functional CSB here, and a lot of places it's just different. It's just different, so one size does not fit all, and we probably some flexibility makes perfect sense.
And I would say the language that requires counselors to spend 80% of their time doing non-administrative tasks, that was critical. I completely support that, because in many school districts, counselors then were used to be testing coordinators, and so they basically administered SOL tests, and managed all that, and that is critical to move them into that area. We just need more flexibility to also bring in additional staff with different levels of expertise and in different areas.
Thank
you.
My name is Rachel Hoddyshaw. I'm the Executive Director for Open Doors, which is a local emergency homeless shelter for adults in Harrisonburg. I have to start by saying, as a United Methodist preacher's kid, I heard a sermon and then I heard a call to tithing for 10%. I didn't